Thanks for joining me on Med School Radio, where we think about topics we're likely to see on the USMLE. One of the commonly presented cases is a case where there is a prolactinoma, where there is an oversecretion of prolactin because of a pituitary adenoma. And you're presented with a man or a woman who has a problem. For example, there may be gynecomastia in a man, or there could be impotence. A woman may be presenting with galactorrhea, which means that the breast is secreting milk, even though there is no breastfeeding and there's no pregnancy. So the question, firstly, is what is the mechanism by which prolactin is controlled? And that is by the secretion of dopamine. So then the question is, how are we going to control this problem with prolactin? And that is to give them drugs that would control it. Or, of course, that could be a surgery that would take off the prolactinoma. But the question here is, what is the medication? And the medication here would be a dopamine agonist. And this would be cabergoline or bromocriptine. So try to remember these drugs and understand that these are being used to return the dopamine suppressing system to the brain so that prolactin can be controlled and that the problems are not seen. Some of the problems you might see in premenopausal women could be problems with their monthly period. They could have amenorrhea or oligomenorrhea, infertility, galactorrhea, as I was saying. They could have hot flashes or decreased bone density. If they are postmenopausal, they could have headaches or visual field defects. And men, infertility, decreased libido, impotence, gynecomastia. So understand this mechanism and understand that in order to treat this, it could be through surgery and dopamine agonists. And these would be cabergoline or bromocriptine.